Hello people, in this video let us look at all the muscles of respiration. So let's start with inspiration. See, if you have to inspire, right, if you have to take in air, the diaphragm has to go down. So remember, this diaphragm is the most important one. Diaphragm, okay? It is the muscle which will help you in inspiration. So what is your answer? For inspiration, you should say diaphragm. Okay, which are the other muscles? The other muscles will be external intercostal and internal intercostal. Okay, so you can see in between these ribs you have these intercostal muscles. Okay, so they will lift these ribs. Okay, so we're not talking about the action, we're looking at the muscle names only. So the muscle name you learned is which one? Diaphragm. Very good. And which one is it for which are the other muscles? Intercostal muscles. Very good, very good. Now let me ask you about expiration. So you want to breathe air out. Okay, for that you don't need any muscles. For expiration, you don't need any muscle. Okay, that's why people say they expired. When they expire, they don't need any muscles to expire out. Correct? So expiration, no muscle. It's a passive process. So what you're looking at here, this inspiration and this expiration which we told you, this is all quiet inspiration, quiet breathing, normal breathing, quiet inspiration, quiet breathing. For that you need what? Diaphragm, intercostal muscles, and for expiration you don't need anything. Correct? Now what if you want to do some pranayama and some deep inspiration? For deep inspiration you need these muscles: erector spinae, scalene muscles, pectoral muscles. Now where are these muscles? Let's look at them. Erector spinae, pectoralis, major, minor, everything, and scalene muscles. So scalene, you have anterior scalene, posterior scalene, middle scalene, so many muscles are there. Okay. So for deep inspiration, erector spinae, scalene muscles, pectoral muscles. Say for deep inspiration, for your pranayama, you have to add these muscles. Okay, it's not like only these muscles. Initial muscles plus these muscles. Erector spinae, pectoralis major, pectoralis muscles, and scalene muscles. Very good. Very good. Now let's go to the next one. Forced inspiration. When will you do this forced inspiration, people? I will force you, inspire. This must be something really very stressful, I'm thinking. For all your spirometry tests and all, you will do forced, like that one. Okay, so here you will need the trapezius, levator scapulae, rhomboids, and the serratus anterior muscles, along with the other muscles that we discussed till now. Pectoralis minor, etc., and the erector spinae, all those extra, those muscles will act more. So the existing muscles which I told you, they will act more than what they do. Plus you have four muscles, which are these: trapezius, levator scapulae, it will lift the scapula, rhomboids, again rhomboids you have major, minor and all that, and then serratus muscles. Serratus, I think they talked only about anterior only, right? Anterior muscle. Okay, so let's go back here. For forced inspiration, trapezius, levator scapulae, rhomboid, serratus anterior. Okay, so you got the muscles of inspiration now. Very good, people. Now shall we move on to expiration? Yes. Now let's talk about expiration. So let's make this small image. We're talking about expiration. So expiration, what did we tell you? It's passive process. So basically that everything will go back to whatever had expanded. Okay. And some abdominal muscles. Okay, just front of your abdomen you pat like this. These are the anterior abdominal wall muscles which will help you in some expiration. Forced expiration actually. Okay. Deep and forced expiration, same anterior abdominal muscles, and along with that latissimus dorsi. Only one muscle name you have to remember. Which one is this latissimus dorsi? No. See, front abdomen is working, means behind somebody is working. Who? Latissimus dorsi. Dorsi, dorsal, back. Remember. Latissimus dorsi. Okay. So that's all you have to learn. Inspiration, expiration, muscles we completed for you. What you have to, next you have to learn is the movements. Okay. What actually happens when you inspire? Those are actually the movements that these muscles bring out, that we did not cover here. But anyways, let me tell you, the diaphragm goes down, so the vertical diameter will increase. The ribs go up. This is a bucket handle kind of going up, so the transverse diameter will increase. Then you have the sternum also go up. Okay, sternum will kind of go up like this, so that is pump handle. So what will happen? Just imagine your sternum, keep your hand on your sternum and make it up. So that is anterior posterior diameter will increase. So basically lot of space for your lungs to expand. Correct? This is in inspiration, normal. And we told you in forced inspiration what will happen? The scapulae from the back, raise your shoulder scapulae, the scapulae also will get elevated. Okay, so that also we told you. So you want to increase the volume of your thorax. And when it is expiration, it's just going back. Recoil of the chest wall, tone of the abdominal muscles. Okay, so that's all. Contraction of these muscles, that's all they are saying. So it is just going back. Expiration, not much movement that you have to know.